Hi, my name is Brittany Derry. I am the Director of the Crisis Center and Clubhouse Programs.
Hi, BestSelf. My name is Kevin Beckman, and I'm the Vice President of Health Home Services, and I will also be overseeing the Crisis Stabilization Center. We want to take a few moments to give you a brief update on some of the activities that have been going on regarding the Crisis Center. First, we want to talk about the name. We have come up with a fantastic name, and it will be the BestResponse Crisis Center. And we think, although we are in the early implementation stage, we think that this will be a great opportunity, not only to BestSelf, but also to the greater community. Brittany and I, we have been conducting what we have been calling listening tours. We have been meeting with some community stakeholders to get their input on what they would like to see at the Crisis Center. Brittany and I will also be meeting with some of you shortly to get your input. We're calling those thought leader conversations. So you guys know best how to engage with the clients who are coming here and have chosen BestSelf for services. So we will be meeting with you shortly. We received a Crisis Stabilization Award, one of the only in the several counties in the area, which include Erie, Niagara, Cattaraugus, and Orleans. And so Brittany now will give us an update on some of the day-to-day operations of the Crisis Center.
We will be located at 430 Niagara in Buffalo, New York. We are looking forward to is being able to help everyone beyond BestSelf. So we will be able to help all of the counties of Western New York with you may have insurance, you may not have insurance. So we will have an open door policy or no wrong door, and we will be able to help everyone and anyone that walks through. So for you at BestSelf, if you have someone that is in dire need of, say, medications, a medication adjustment, or just seems to be more symptomatic, send them our way once we are open up, hopefully by the end of the year.
One of the additional things that we're looking to utilize the Crisis Center for is true hospital diversion. We know that a great number of our clients, when they are in need of some additional support, doesn't necessarily need to go to the emergency department or a CPAP unit. They can divert to us, and we can assist them up to 23 and a half hours for what we call crisis stabilization activities. Like Brittany mentioned, medication services, we're going to have peers, we're going to have a TCM and care managers embedded in the services. We have nursing and a variety of resources to be able to help that individual stabilize in the community. One of the other things that we're going to work with is some of our community partners to make sure that after they present to the Crisis Center, we can set up aftercare for those individuals or community-based services. So they can be linked with any outpatient private psychiatrist and present to the services, and then we will either ensure linkage back to those services, and if the individual isn't linked, we will assist them to making sure that they have the appropriate level of community-based services to maintain their stability and functioning in the community. And we're going to also make sure that we work with the first responders. So in our efforts to truly divert from hospital unnecessary or avoidable or preventable hospitalizations, we're going to work with first responders. Our first responders will have a separate entrance so that they can bring individuals into the facility in the most discreet and private manner possible. So individuals can present to the center escorted with first responders by themselves. Family can call. And of course, any of our BestSelf counselors, supervisors, directors can also call to link individuals with the BestResponse Crisis Center.